Welcome to a conversation with your American Cancer Society Board of Advisors. My name is Felicia Cassow, American Cancer Society Volunteer and Director of Marketing for Pure Mammography. Today we are speaking about the topic cervical cancer. In 2022, it was estimated that 14,100 new cases of cervical cancer will be diagnosed in the United States, with an approximate of 4,280 deaths related to this disease. The American Cancer Society Board of Advisors for the Long Island market is dedicated to have conversations around topics like cervical cancer to further educate our community on the risk, prevention, and screening so that we together can end cancer as we know it for everyone by improving the lives of people with cancer and their families through advocacy, research, and patient support to ensure that everyone has an opportunity to prevent, detect, treat, and survive cancer. The American Cancer Society recommends that people ages 25 to 65 should get screened with a primary HPV test every 5 years or a pap test every 3 years. I'd like to welcome our guest for today, expert in the field, Dr. Yee, Assistant Professor at Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Welcome, Dr. Yee.
Good to be here.
Thank you. We then will hear from cervical cancer survivor Molly Bernstein, who will share her story. Hi, Molly.
Hello.
Thank you for being here.
Thanks for having me.
And welcome back Maureen O'Connor, Director, Cancer Services Program of Suffolk County, Peconic Bay Medical Center. Hi, Maureen. Thank you for being here.
Thanks for having me.
Thank you, everybody, for joining. Cervical cancer incidence rates have declined by more than half in recent decades, largely due to widespread use of regular screenings. How do people get screened for cervical cancer? What are the types of tests, Dr. Yee, we should be looking for?
So there are several tests that are available for screening. There are pap smears. There's also HPV testing that can be done alone or in combination with one another. Like you said before, it can be done, starting at the age of 25, but can be even started as early as the age of 21, depending on risk factors.
What are some of the signs and symptoms of cervical cancer?
Cervical cancer can be a little bit tricky. There are some patients that are completely asymptomatic and would never know that they had cervical cancer. Some symptoms, though, that may show up with cervical cancer include vaginal bleeding and abdominal pain, and even sometimes bloating.
Who should be getting screened?
So, like I said before, anyone over the ages of 21, sexually active, and has a cervix should be screened for cervical cancer.
Okay, so anyone who has a cervix.
Yes.
What are the risk factors?
So HPV infection is probably the most important risk factor for the development of cervical cancer. There are some other risk factors as well, including patients that are immunocompromised. So that includes patients that are on immunosuppressive therapies for things like autoimmune disease or have received a transplant. And importantly, patients with HIV as well.
So for those of us who aren't really sure, what is, HPV and how do we associate HPV with cervical cancer?
So HPV is a sexually transmitted disease. When it infects cells in the cervix, it can change the genome of the cells and predispose those cells to becoming cancer.
So does everyone who has HPV get cervical cancer?
No, not everyone with HPV develops cervical cancer. There are specific strains that are more associated with the development of certain cancers.
So if someone didn't ever have HPV, does that mean they have no risk of getting cervical cancer?
No, there are other risk factors that are that may predispose someone to cervical cancer. Like I said before, immunocompromised states, smoking, HIV infections can also cause cervical cancer. Although those are pretty rare cases, the vast majority of cervical cancer cases are caused by HPV.
Understanding that HPV is linked to a cervical cancer as well as other cancers, including throat, cervix, vulva, vagina, penis, anus cancers, can you share with us what should the community know about HPV vaccination and why is it so important?
So HPV vaccinations have been shown in many clinical studies to be effective in preventing the infections with HPV, and also have been shown to decrease the risk for the development of cervical cancer and those other cancers that you just described.
Is it safe, the vaccine?
Yeah, in these clinical trials, these vaccines were found to be very safe.
So who should be getting the HPV vaccination? Is it only people with cervix? And what about children?
So anyone with the cervix should get the HPV vaccine. Children, the vaccine is given starting at age 11 to 12 and can be given up to the age of 26. Patients over the age of 27 should probably discuss getting their vaccine with their OB or their primary care provider. And that decision is based on certain risk factors.
Okay. And is the vaccine covered by health insurance?
Oftentimes it is, yeah.
Oh, great. And where can I get the vaccine? Where can somebody go get that?
So I would start by talking to your OB or your primary care doctor. These vaccines are widely available.
And where can I learn more about that? From my doctor, the vaccine?
Yes,
Okay,
that would be the best person to speak to first.
great. If someone is diagnosed with cervical cancer, what can they expect?
So they should follow up with several doctors who are important for the treatment of cervical cancer. And that may include seeing someone like me, a medical oncologist, in addition to a gynecologist who specializes in treating cervical cancers with surgery, and sometimes a radiation oncologist as well, who gives radiation for the treatment of cervical cancer.
So the treatments are based on staging, the stage that
That's
it's in.
exactly true. Early stage cancers may be treated with surgery alone. And as actually, I'm going to just rephrase that. Early cervical cancers are treated with procedures or surgery and can sometimes include radiation, while more advanced cervical cancers like stage 3 or stage 4 cervical cancers are treated with chemotherapy and sometimes radiation as well.
How is quality of life affected by cervical cancer? Like, for example, their sex life.
So the quality of life in someone that is getting treated for cervical cancer is good. I would be lying if I were to say that there were no side effects related to treatment. But when I see patients for cervical cancer, I tell them to remain motivated for treatment because generally speaking, the treatments that we have, especially in this era, are very good, and side effects related to treatment can be pretty well managed.
Are there any last thoughts that you want to let our community know that we should know on this?
Well, as someone that specializes in the treatment of gynecologic cancers, I think that it can be pretty heartbreaking to take care of cervical cancer patients, knowing that there are very effective screening tools and vaccinations that are out there to reduce the risk for cervical cancer. So if there's one thing, if there's one thing, one takeaway for me today, it's that, if I can get more people to get vaccinated, get more people screened earlier in life, that is,
Thank you.
it's great. Yeah.
Thank you so much, Dr. Yee, for your insight and expertise. We've definitely learned so much from you today, and we really appreciate your expertise today.
Thank you so much for having me.
Thank you. Next, I have the privilege of introducing Molly Bernstein, an American Cancer Society volunteer and a cervical cancer survivor, to share her story. Welcome, Molly.
Thank you for having me.
Thank you. Can you tell us a little about what happened and your story?
Well, I was diagnosed with cervical cancer in February of 2019. I was experiencing abnormal bleeding in between periods for a few weeks, and thought maybe it could have been fibroids, maybe it was early menopause, but I wasn't quite at the menopausal stage yet. So I went to the gynecologist. I called the gynecologist out of the blue. I had just moved out to Long Island, New York, so I didn't have a doctor out there yet. And I just kind of picked someone off of the browser who had a friendly face and said, I know you hear a lot of this, but I think I have an emergency here and I need to get in. And 2 days later, I was at the gynecologist and she examined me and she said, I don't like what I see. And I said, what do we do? And she said, you need a biopsy. And I said, okay, let's do a biopsy. And she said, I don't do them on Mondays. I don't have the numbing creams and everything that I need to do it to make you comfortable. And I said, just do it. So she did it. And a few days later, the results came back as severe dysplasia, SIN3. And so she called me and she said, you know, I think that we can manage this, but I was proactive. So I called an oncologist that I know, and you're seeing her in 4 days. So I went to that oncologist and she did an exam, and the goal was to do a deeper biopsy just to make sure that it wasn't cancer. She did the exam, she sat back and she said, I'm sorry, but you have cancer. And she had to do the cone biopsy because, you know, they had to see what stage I was at and then do a PET scan to determine what my treatments would be. Unfortunately, after the cone biopsy results came back, it showed that the cancer had spread to 2 lymph nodes right outside of my cervix. So I was not a candidate for a hysterectomy. So I had to go through 6 weeks of chemoradiation. 3 months later, I had another PET scan. It was clear. 3 months after that, I had another PET scan. It was clear. 3 months after that, I had a PET scan, and the cervical cancer had spread to a lymph node in my neck. So I used my creative influence and I talked a neck surgeon into doing a radical neck dissection just to get the tumors, the lymph nodes that were cancerous out of my neck and hopefully call it a day. That happened, and 6 months later, the cancer came back and again in the lymph nodes in my neck. I went through another 6 weeks of radiation and again was cancer-free for about 9 months. In August of 2021, the cancer came back, this time in my 4th vertebrae, a very small, active cluster of cells on my 4th vertebrae, which was treated quickly with radiation because it's on the bone and not in soft tissue. 3 months after that, PET scan showed that I was cancer-free. And as of today, I've been cancer-free for over a year.
Wow. It's great.
Congratulations.
Thank you.
That's great.
I was never diagnosed with HPV. I also was never diligent about getting my pap smears on time. And this is not an excuse for anybody, but I moved around a lot because of the job that I had. And, 3-4 years would go by in my late 20s and 30s. That is one of the main reasons why I like talking about, why I think it's important to talk about cervical cancer, because if I had been better about getting my pap smears, I would never have gone through what I went through. even without having HPV, even knowing that I was a healthy, fit, felt great, was never sick a day in my life person, you can still get cancer, but you can prevent all of the pain that you have to go through with treatments, with chemotherapy, the toll that it takes on your family. You can prevent all of that if you just get screened. I was married for 3 months when I found out that I had cancer. And I can deal with how difficult it is for me. What cancer patients, I think, have the most difficulty with is dealing how it affects the family and the loved ones. So save your family and your loved ones from that grief and just get your screenings. And I think that's the most important message of this podcast.
Wow. Thank you so much, Molly. We've learned so much from you today. And most of all, we've learned get checked and get screened. And we really appreciate you telling your story and the importance of early detection. So thank you so much.
Thank you.
Maureen, what are the resources out there that can help people get screened, and where can they go to get more information?
Sure. Well, I just wanted to shout out everybody, on this podcast talking about the importance of getting screening, and, that cervical cancer is a cancer that is preventable, right? With early detection, with vaccines, with, regular care. And so, as was mentioned earlier, you want to have a conversation with your primary care provider about what your screening needs, when you should start screening. It might be different for you based on, you may have other factors that are going to make you get screened earlier. And the regularity of your screenings, what those should be as well. My main message tonight is that I'm assuming that people may be listening to this saying to themselves, well, I don't have health insurance, so what does that mean for me? And how am I going to get the screening without health insurance? And that I wanted to make sure that people knew not to let the lack of health insurance keep them from getting screened. I represent tonight the Cancer Services Program, where we provide women without health insurance or anybody who has a cervix, who doesn't have health insurance, who has inadequate health insurance, that we can get you cervical cancer screening. It's available to you. For us, it's for individuals 40 and older. We can get you access to a primary care provider. We can get you access to a PAP and HPV test. We can help pay for that. We can pay for any diagnostic studies that you need. And then we can help you access treatment if diagnosed without health insurance. So I just want to encourage people to please be aware of that. And there's also, sliding scale fees that are available to people that if they need. So I encourage people not to let that stop them. They can find us. There are programs in Suffolk County. There's a program in Nassau County. You can find us on the Department of Health website. Suffolk County. I think you can find us on the ACS website as well. And please feel free to reach out to us, and let's see if you're eligible for screening and get you into screening.
That's great. Thank you so much for that information. It's so important. Thank you for joining a conversation with your Board of Advisors of the American Cancer Society. Let's continue the conversation by sharing with our families and our friends about the importance to get screened and consider HPV vaccination. As always, if you're looking for more information or assistance regarding your cancer journey, I invite you to call your American Cancer Society at 1-800-227-2345 or visit cancer.org. you.